Learn how I got this mid-face result for my patient. This patient's primary concern was roundness in the cheeks. I observed that the central cheek fat pad had shifted downward, making the lower cheek appear fuller than the cheekbone. To address this, I decided to enhance the lateral zygoma to create a lifted and defined appearance. I made sure to avoid adding volume to the central cheek, as it was already sufficient. I identified the lateral surface of the zygoma as the primary injection area. I checked for the superior surface of the cheekbone to ensure I would create a lifted effect rather than adding fullness to the lower cheek. I then identified the defining lines and planes to enhance. This is the defining point of the cheek. These 3 dots will form the defining line of the cheek that we want to draw attention to. I'll be injecting superiorly here. Holding the needle at a 60-degree angle, I carefully aspirated and then injected in an upward, not lower direction to enhance the lift. I injected small amounts, 0.1 milliliters per point, into the lateral zygoma, moving outward from the midface. To prevent filler migration, I supported the area with my finger underneath. You can now see the difference between the treated and untreated side. But then I noticed a small shadow, so I adjusted my approach by adding small amounts of filler near the eye anteriorly. After treating the other side the same, you can see we now have the defining lines of the jaw and cheek in harmony. But I wasn't finished. I then went in to treat the nasolabial fold. I used both needle and cannula techniques for the nasolabial fold. With a needle, I injected at the periosteum near the alar base to provide structural support. This helped create a smooth transition between the cheek and lip area. The final outcome for this patient's mid-face was a lifted and well-defined cheek structure with a smooth transition to surrounding features. If you want to learn more about how to use defining lines and facial planes to create natural, high-volume results with confidence and no overfilling, check the caption for details.